Hello, lovely people. Welcome to YOUHEAL channel. So on the 23rd July 2022, the WHO just declared monkeypox a global outbreak, which represents a public health emergency of international concern. So we would like to dive into the information that the World Health Organization is giving us to know more about this outbreak. But before we do this, I would like to remind you to click the subscribe button if you are new to this channel for more health-related content. Okay, let's get into it. What is monkeypox? Monkeypox is an illness caused by monkeypox virus. It is a viral zoonotic infection, meaning that it can spread from animals to humans. It can also spread from person to person. So what are the symptoms of monkeypox? Monkeypox can cause a range of signs and symptoms. While some people have mild symptoms, others may develop more serious symptoms and need care in a health facility. Those at higher risk for severe disease or complications include people who are pregnant, children, and persons that are immunocompromised. The most common symptoms of monkeypox include fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes. This is followed or accompanied by a development of a rash which can last for 2 to 3 weeks. The rash can be found on the face, palms of the hands, soles of the feet, eyes, mouth, throat, groin, genital areas, and anal regions of the body. The number of lesions can range from 1 to several thousand. Lesions begin flat, then fill with liquid before they crust over, dry up, and fall off, with a fresh layer of skin forming underneath. Symptoms typically last 2 to 3 weeks and usually go away on their own or with supportive care such as medication for pain or fever. People remain infectious until all of the lesions have crusted over, the scabs have fallen off, and a new layer of skin have formed underneath. Anyway, anyone who has symptoms that could be monkeypox or who has been in contact with someone who has monkeypox should call or visit a healthcare provider and seek their advice. Can people get seriously ill or die from monkeypox? In most cases, the symptoms of monkeypox go away on their own within a few weeks. However, in some people, an infection can lead to medical complications and even death. Newborn babies, children, and people with underlying immune deficiencies may be at risk of more serious symptoms or death from monkeypox. Complications from monkeypox include secondary skin infections, pneumonia, confusion, and eye problems. In the past, between 1 to 10% of people with monkeypox have died. It is important to note that death rates in different settings may differ due to a number of factors, such as access to healthcare. These figures may be an overestimate because surveillance of monkeypox has generally been limited in the past. In the newly affected countries where current outbreak is taking place, there have been no deaths to date. Who is at risk of catching monkeypox? People who live with or have close contact, including sexual contact, with someone who has monkeypox or who has regular contact with animals who could be infected are at most risk. Health workers should follow infection prevention and control measures to protect themselves while caring for monkeypox patients. Newborn infants, young children, and people with underlying immune deficiencies may be at risk of more serious symptoms and, in rare cases, death from monkeypox. People who were vaccinated against smallpox may have some protection against monkeypox. However, younger people are unlikely to have been vaccinated against smallpox because smallpox vaccination stopped in most settings worldwide after it was eradicated in 1980. People who have been vaccinated against smallpox should continue to take precautions to protect themselves and others.